Thank you so much for being with us today.
Thank you for having me on. I really appreciate it.
Would you like to introduce yourself to the audience and what you do?
Sure. My name is Dr. Lonnie Herman, and right now, my clinic is in Southeast Florida, just about 20, 30 minutes north of Miami. People are pretty familiar with that area. And we work with patients who come to my clinic from around the world, literally from not just in South Florida near me. I mean, people come from across the United States, but also from other countries. We have a lot of our patients who come here from United Kingdom, from Ireland, from Australia, from Israel, from I could name many different countries that come here for this unique work that I do. And what we're all about is helping people to rapidly restore their health after nothing else worked for them, or something that they did, whether it's a functional medicine method or they did acupuncture, or they even had medical intervention with their condition, where they may have reached a plateau. If there was some improvement and they reached the plateau, we're able to really get to the root cause. We're able to help figure out what's causing the disease, clean their cells out from their brain and their body. And we see people literally restore their life. They're able to just go back to work. They're able to have relationships again. They're able to travel and just be pain-free and stop the suffering. So that's what we're all about.
And can you explain to everyone the difference between what you do and functional medicine?
Sure. And I'll start out by saying I did functional medicine in my past, and I can go further in discussion. I'll just let you know that in my website, I have a free download for people who can download my free book about how people can literally reverse disease, the quote unquote incurable diseases with this quantum energized medicine. So on the last page of that book that is free again for people to download from my website, I go into a long discussion for about 42 minutes about my work and about my journey as a physician. So they can see that. Okay. So functional medicine, I did that years ago, and I realized something very quickly. After I took immunology in postgraduate studies, I realized something very quickly. Because the immunologist who was teaching that program, or taught that program, I should say, who's over 40 years in the immunology industry, who's well known in peer-reviewed journals, and he actually had discovered and patented certain antibodies that he discovered in the laboratory. So people may be familiar with like a thyroid antibody for like Graves' disease or Hashimoto's, and there's many other antibodies that can be studied for, let's say, MS or for lupus. What he showed us in one of the images he showed us was that the mercury filling from a tooth could go right down to the thyroid and cause the Hashimoto's or Graves' disease in the person. And also, he pointed out with these journals from scientists from around the world who were not funded by drug companies, these scientists had run their own studies on looking for what was causing disease. See, when a drug company runs the study, they want to say that their drug is the answer to help rid the symptom. When these scientists were running studies, they were able to induce disease in, let's say, a mouse or a rat. They were able to create MS. They were able to create rheumatoid arthritis. They were able to create lupus or asthma or a skin rash. And if they can induce, since they were able to induce the disease in the laboratory experiment, they knew what was triggering the disease. They also, with certain patients, literally humans, they would go, let's say with rheumatoid arthritis, they would take a biopsy of the fluid in the joint that was arthritic, where there was a big nodule in the finger. And they found parasitic and or bacterial infection in these joints. And they also took biopsies of certain arteries of the human body in rheumatoid arthritic patients. They found the arteries had the same bacteria or parasitic infection that caused the hardening of the artery. It wasn't cholesterol-filled arteries that made the arteriosclerosis happen. They also found in that particular study I'm talking about that the parasite and bacteria was in the gums. So it traveled around the body and made disease occur. These organisms traveled around the body and made disease occur. The same in these studies for asthma, they found viruses and bacteria and chemicals in the lungs that made the asthma happen. And the same goes for skin, like eczema, same thing. Let's say there was a staph infection or a scabies infection in the skin or a candida fungal infection in the skin that made the skin rash happen. So when I completed the immunology program, I called up this immunologist to open my mind and my eyes to the reality of what was causing the disease. And I was pretty far into the functional medicine type of work of running different laboratories before I called him, of running food sensitivity studies, of running leaky gut testing, of running adrenal hormone testing, of running a full panel of hormones on a woman or a man, of running genetic testing, of running for the MTHFR gene and other genetic testing. I was running stomach, looking for H. pylori in the stomach. I was running, there were so many different labs, urine tests, heavy metal tests in the hair, heavy metal tests in the urine. And that was part of the whole functional medicine realm of testing I was doing. And when I got done with that immunology program, and I called the immunologist and I asked him this question. First, thank you very much. I appreciate that you shared all that information. You opened my mind, and thank you for helping me become a better physician to help people. But you showed a picture in that class of the mercury from the tooth going to the thyroid gland, and that was causing the thyroid disease. How am I going to find that with all the laboratories I'm running with people? You know, the whole functional medicine school that we're going through. How am I going to find it? Because a hair analysis can tell me if there's mercury or lead or arsenic, but it's not going to tell me that's in the thyroid gland. And I can run a urine test that can tell me that there's mercury in the urine, but that's not going to tell me there's mercury in the thyroid gland. How am I going to find that? I can't take a biopsy of somebody's a thyroid. And he said, you're absolutely right. Now you know the reality of what can cause the disease. Good luck. Try to find it, because you're not going to find it in the functional medicine laboratories that you're running. And I got off the phone depressed. I was like, I went from being so excited to speak with him and so excited about what I finally realized to now, like, what do I do to really help people who are suffering with these different ailments? I'm not going to find in a stool test I could run on someone to look for a parasitic infection in the stool. That's not going to tell me if there's a parasite in the synovial fluid in the joint in their finger causing the arthritis there. So if, let's say there was a bacteria or parasite that was in their stool and somebody took an antibiotic or some different herbal formula, or they did whatever they think they can do to castor oil packing or enemas or anything to rid the infection in the intestines, that's still not going to rid the infection that's in the joints causing the inflammation in the joint. You understand? So functional medicine, it seemed to be very logical. It seemed to be a very connect the dots type of system. Yet I realized, again, as I just said, I'm not going to find the mercury in the thyroid or the parasite that's in the joint in the finger that's making the arthritis or making the thyroid disease. So with a functional medicine type of assessment or a functional medicine type of treatment, I couldn't literally clean the cells, maybe in some people, but for the really chronically ill, where some things were not working for some patients. I'm not into getting 1 out of 10 better. I want to get closer to 10 out of 10 getting better with my work. And that's for any symptom. It doesn't matter what the disease of the symptom is. I want to help everyone. And that's what we're after here. So my work now is we're literally with using principles that were developed by biophysicists and quantum physicists. We're literally able to listen in to that organ or that gland or that part of the brain and find the specific toxin or series of toxins and infection or series of infections and toxins that are in a part of the brain, that are in the bone marrow, in the lymph, in the thyroid, in the uterus, in the ovary. We can find these and help the person safely and effectively rid them using this is deeper than what some people may have heard before. Some people know, some people yes, but it's frequencies. We're able to literally match the frequency of the infection that's in the, let's say, the cervix or in the thyroid, and the body will just rid it naturally. A like cures like type of principle is applied with this work, and that's what we're doing now.
So how do you listen in on it? What kind of machine device is used?
Yeah, that's a great question. So thank you for asking that. I'll tell you that I don't trust the machines. I had a machine scanner years ago. When I got into frequency and understanding with frequencies, there was a machine, I don't know if you've ever heard of, or your listeners or followers have heard of, Rife machine. Mm-hmm. Okay, so that was my first introduction into frequency. And I believed it. And because I heard about practitioners getting people better using that type of equipment. But with that equipment, I bought like the top of the line, and it came, the model that I bought and with the package that I bought had a frequency scanning device. connected to the computer, connected to the instrument, and some scans would lead to 10 minutes or 3 minutes or 20 minutes or an hour scanning program. And when I saw in people that the machine would print up or reveal to me on the computer screen that there was, let's say, there was E. coli, there was staph infection, there was syphilis, there was Epstein-Barr virus, there was HIV. And I said, these people don't have HIV. I'm not going to diagnose this person as HIV with, I mean, that's just crazy. And these people didn't have HIV, okay? So when I called the company and I asked the company, how is HIV coming up here? I can't report this to people. I'm not going to just come out and say that. I don't have a true blood test. This is not, I can't diagnose. No, you can't diagnose with this. That was number one. Number two, we're going to print up, the computer will read frequencies that are similar and produce similar kinds of, not same, not exact, but it will produce a similar kind of, anything that's close to it, it's going to print up for you. And I said, well, I just can't use this. It's just not, it doesn't make sense to me right now. And also what they provided, they taught me something. When a person was on that kind of scanning device, a computerized scanning device, that if the person moved at all during the scan, if they weren't sitting completely still like a mummy, so to speak, I'm kind of being facetious there, but not, they had to be still. They could not move their finger, they could not move their head, they could not move their foot. If they were sitting there for an hour, they couldn't move at all. And if they did move at all, the body was producing different frequencies, different energies were released by different parts of the nervous system, and the machine would read that, and it will produce a report showing that they had XYZ, whatever infection that was supposed to be close to that frequency that the body was emitting from a physical movement. So I don't use the computers for, that's one of the reasons. I'll get into my testing in a moment, but I'll tell you that the other is that we've really got to understand from a testing perspective, to get the right answer, to get people well, which is all that matters here, is the results, getting really impressive results for people where nothing else worked before. One of the main things that we've got to understand is that there's interferences that exist in the body and around the body in the testing environment that can produce a false positive. And we've got to be very careful to not read with a computer machine that can give us a false positive in something. So what's an interference or what's a block that can do that? A cell phone, X-ray in the human body, the Wi-Fi modem that may be in the office space or home, the 5G tower that's coming into the facility. So, and there's many more. I won't get it. Somebody's car key remote, the battery from the remote, or they have Bluetooth headset, or they have one of those new Apple watches on, or it's off the body, but it's in the room. And there's many others without getting into all of that. There are certain interferences from the electronics or the EMF or electromagnetic field stresses that can also, which from a computer machine scanning the body is putting more of that electromagnetic stress into the human body, which will cause false positives or false negatives. So we've got to understand from a much deeper perspective about the energy that we're testing and what's involved in the environment that can literally produce the wrong answer. So I don't use a computer machine. We've got this device that is made, no computer, there's no electronic. We've got a device that's made of, it's an aluminum plate, like a platform that lies on the table next to the person. And there's a copper wire that's insulated that's connecting the aluminum plate to an aluminum handle that's in the person's hand, like a wand. Mm-hmm. Now, we understand from something that we're probably familiar with, like a jumper cable, right? If we connect that cable, which is made of metal, that's surrounded by like a rubber kind of plastic coating, so we don't shock ourselves when we touch it. But we put the positive and negative clamp on a healthy battery, put it on the dead battery on the other side. Within a few minutes, we could start up the car that had a dead battery. How did that happen? Somehow the energy travels through the wire, and we can take a dead battery and bring it back to life and drive away. We still have to get a new battery. But the point is, without engineering school, without physics school, without reading a meter, watching it, the energy travels through the wire, and we can take good battery, give it to the dead battery, and start up the car. The reason why I'm sharing that, something that we're familiar with, is with this work, when you're holding onto the aluminum wand in your hand with a copper wire to the aluminum plate, and I can take a sample of a poison that would hurt you. I won't give it to you. But I take a sample of the poison that's in a sealed vial, and I put that on the equipment. What these scientists found is the energy, just like the jumper cable, energy travels through the wire to battery. The poison energy will travel through the glass vial, through the metal plate, through the metal wire into the metal tool in the person's hand. And what I, as the observing physician who's testing the patient, I'll witness the body goes into a stress state. I'll see the body go from a relaxed state. Now I put the poison connected to them. The body feels the poison and the stress occurs. I can measure the reflex from it. So a reflex that people are probably familiar with is like a knee jerk. Hit the knee with a reflex hammer, you see it and feel it in your own body. The doctor can see it. The doctor doesn't feel it. The patient sees and feels it. If a doctor ever shines a light in a person's eye, we see the pupil reflex occur. The pupil reflex is muscles controlled by the nervous system in the brain. Muscles in the color part of the eye, they squeeze down and make the pupil smaller because the light's too bright. It's hurting the eye and hurting the brain. If we take away the light from the eye, what happens? It reflex disappears. The pupil dilates. That reflex, people don't see it in their own eye. They don't feel it, but the doctor can see it happen. So back to my testing with no electronics because of interference that happens from these electronics. When I put the poison sample down, the first step I do, poison sample on the equipment, the body shows me the reaction that I can measure, that I can see, but the patient doesn't feel, just like the pupil, they don't feel. So now with this equipment, I take away the poison. I can have them through multiple different strategies that I developed over the past 10 years. I'm able to take the person through a series of exam steps that, let's say, for example, somebody has asthma, okay? And I have the sample of the perfect lung tissue. I have a sample of the perfect trachea. I have a sample of the perfect diaphragm tissue. I have a sample of the influenza virus and the Epstein-Barr virus and a staph infection and many different things that can invade the body causing the asthma. When I have the perfect samples of those tissues and I have a person with asthma on the table and I tell them to just take a deep breath like this, and we know the respiratory system is stressed because they're asthmatic. Now, when they take a deep breath, the body goes into the same stress state reflex pattern that I can measure just like the poison. You understand? I put the poison there. The poison's not on, but they breathe, it hurts them. So I see the stress reaction, just like if this was a light bulb and I shined it in somebody's pupil, the stress happens. So when they breathe in, the body goes stressed, and I measure that and it stays stressed. And I reach over and I take a sample of the perfect lung tissue sample and I put it down in the equipment. That patient is going to, within milliseconds of being connected to the perfect healthy frequency of the perfect lung tissue, when I put that lung down, the person's going to scan their lungs instantly, compare their lungs to the perfect lung. If the lung is not the reason, number one, why when they breathe in through their nose, if it's not the reason why they're stressed when they breathe, when I put the lung sample down, the body stays in a stress state. We want to come out of stress. We want to go from stress to strong, but that didn't happen. So I put the lung away. I take a sample of the diaphragm. I put it down, and the body goes from stress to no stress. The body diagnosed for me instantly because it feels the perfect energy, the perfect diaphragm. It compares its diaphragm to the perfect diaphragm. And now it comes out of stress from breathing. Now I got my answer. The diaphragm, something's wrong in there. So I leave the diaphragm down, and now I can match up. Is it influenza? Is it staph? Is it what Epstein-Barr virus? Once I find the match, I have them take a deep breath again, and they're not stressed. The stress doesn't happen because the body's going to act as if they took the remedy to get rid of that infection from that organ right there in the moment, even though I haven't applied it to them yet. They're feeling it through the equipment. So the body starts healing right there. So now I can diagnose whether it's from a breathing stress that revealed to me for asthma, or somebody had a rash every time they eat chocolate, they break out in hives. I could give them chocolate. The body shows me a reaction. I'll find, is it the skin? Is it the spleen? Is that making sense what I'm describing to you?
Yes.
That's I'm trying to simplify it, but it goes even on much deeper levels than that, but I'm trying to simplify it. So hopefully that makes sense.
Yes. So do you believe in those, because there's TikToks that I see sometimes where they're like, listen to this frequency and it'll kill parasites. Listen to this is that anywhere similar?
I'll tell you what, I don't use it.
Yeah.
If it was that simple, so I've never done it, so I can't tell you because I don't have experience with that. But I will tell you that the diseases are so complex today because people have pesticides in them. People have weed killer spray. People have anesthesia from dental procedures that stay in the body. People have lead. They have arsenic. They have mercury. They've got different compounds of mercury. I can go on a long list of. Some people have medications they've taken that residues of those stay in the body, antibiotics. They can have multiple different infections of candida and mold toxins and parasites and viruses, and the list goes, and old vaccines that they had as, when they were a child that are pumped into them. So if somebody was to not be able to analyze the patient properly without interferences and get the true answer or answers to what's causing the disease, they can put them with these frequencies in the sounds of whatever they're applying, like you just asked me, oh, it's going to kill a parasite. So maybe somebody's going to get a positive result from that. But when it comes to the complex conditions, like somebody's got chronic sinusitis, or somebody has endometriosis, or somebody has cysts in their breast, or they have Hashimoto's thyroiditis, and the list goes on of terrible diseases that people are suffering from, or MS, or incontinence, that's probably not going to provide the person the benefit. Because what if somebody had a dental procedure done? I'm not blaming a dentist here when I say this, but what if somebody had a dental procedure, they inject the person in the mouth to numb the mouth, 3, 4, 5 hours later, when the dental procedure is done, the numbing chemical left, the mouth is not numb anymore, but that chemical moved through the nervous system up into a part of the brain that controls the bladder. And now they have a problem holding their bladder, and they don't realize the connection. And so they're just like, oh my God, I can't, why am I so, I'm getting anxious. Now I can't hold my bladder. I just peed in my pants. What the hell's going on? I think it's a dead dentist. It wasn't me. We didn't do anything wrong. They didn't realize the connection. So somebody can go through like that. You said on the TikTok video of, just doing a parasite, frequency, but it's the anesthetic that got from the mouth into the brain. All we have to do is find that anesthetic that's in the brain and get it out of there and allow the bladder to come back to normal. So I really just think that those are it's too simple. That's too simple that way that you asked me.
And how many treatments do people need before they start to feel relief?
That's another great question. So I will say that different people have different causes. Okay, so and now we've got to ask about what condition, right? So, and now you can have two, let's say, women who are 30 years old and they both have Hashimoto's thyroid. Are they both having the Hashimoto's thyroid experience? Not a good experience, but are they having that? Are they dealing with that inflamed thyroid, autoimmune thyroid condition because of the same reasons? Does one person have no cavities ever filled and no teeth ever pulled and no root canals ever done? And the other woman, same age, same gender, same part of the country she came from, but she has 3 root canals in her mouth. That can be diseasing the thyroid. What if the person who doesn't have the dental work, but she had some surgery done before because she had, let's say, endometriosis, and they did a DNC to her uterus, and the chemicals that they injected in her actually stayed in the body and went up to the liver and went up to the thyroid and stayed there. But the one who had the root canal, she never was put to sleep for any surgery. She never had endometriosis. She never had anything else done, but she did get Epstein-Barr virus as a kid. She did get staph infection. She had some sore throats. She had some strep bacteria, strep throats, and so on. We've got to understand we've got to be very precise and very specific about the individual. So we can't just say that is every person going to feel better in 1 week of treatment, in 1 month of treatment? Is every person going to follow the same course of action? It's not that way. It's got to be customized per the individual. Because each individual has his or her own individual causes of what made that disease occur. Now, we've had patients come in with POTS. I don't know if you know what that is.
Yeah.
Terrible. One woman, and I have her and her husband on video testimonial. She was about 30 years old at the time. They had to drive to my clinic in South Florida from Texas. She couldn't stand up. She went from being healthy one day to now 8 months of terrible anxiety and serious IBS, irritable bowels, and she had such a tightening of her chest, shortness of breath. I never heard her speak to me. The husband did all the consultation, question and answer with me because she couldn't talk, because she could barely breathe. She was gasping for air constantly. He had to bring her in a wheelchair. She had to lay down in the back of the truck to drive here from Texas because she couldn't sit up in the car. She couldn't get out of the wheelchair. I mean, it was like picking her up, putting her on her exam table to do our exam process. 8 months like that, 5 different blood pressure medicines. She couldn't even breathe through her nose because the nose was swollen internally. They wanted to do a nose surgery on her to open up these nostrils. In her first week of her first protocol that we designed for her, first week, no more shortness of breath, no more swelling in the nose. She could breathe through her nose. She was able to speak to me in a full-on conversation on the phone. First time I heard her voice. First week of treatment. Yet there could be another person, and there are, who it takes longer. It's not just that fast. So I've had people with One mother brought her daughter to me, 19 years old, from Ireland. She had asthma her whole life, brain fog her whole life, constipation her whole entire life, 19 years old. And she had a rash on her skin, and it wasn't an eczema. She had a rash on her chest, her arms, her neck, and her back. A poor young girl. She didn't want to wear bathing suits. She was, just too uncomfortable, and always scratching and itching and insomnia because it was always itching her whole entire life, ever since she was born, the mother told me. In one treatment, the rash completely disappeared. In one treatment, the brain fog disappeared. In one treatment, the asthma disappeared. They did the treatment at home in Ireland. They called me with such an outstanding, they were so impressed, in shock that it was so fast, the recovery. Now I've got another patient who comes in with an eczema where it took 2 treatments. It took 6 months. It wasn't just within a 1 month or 2 month treatment to get rid of the rash on the skin, for example. So it just depends on the individual, is the best way that I can say it. But rapid is when we can help somebody get rid of the causes, when we can help them clean their cells out of the organ that's infected, causing the symptom, and they're able to be, back to life. If it took 2 months or it took 6 months or it took 8 months, whatever it is for that person, and I want it to be fast, just like they do. I'd rather have it one day and it's all gone. But when they have their life back in less than a year or in less than 6 months, it's better than living with it for the rest of their life and shortening their lifespan and living in misery. So does that answer good
Yes.
enough for you? Okay.
Yes. So why do you think there's so much rise in hormone problems and chronic illness?
Well, one thing that we do know is that there are many more toxins now than ever before in history. There was a study done in 2005 by the Environmental Working Group, EWG. It's called the Body Burden. And I think it was coordinated with the Red Cross. Was it Red Cross? Is that the name? Yeah. So excuse me for that. What they did was they went across the United States, any city, any state, any newborn infant in any hospital, boy, girl, race, religion, didn't matter, any city, any state, any hospital. The babies were still attached to the mother's umbilical cord. The babies did not get a vaccine yet, and the babies were seemingly healthy at birth. They found that these babies, with the biopsies they took of them, before they detached the baby from the mother, they took biopsies. They found 287 toxic cancer-causing chemicals in the babies that were just born. They found the same in the mother's umbilical cord blood. The same chemicals are there. DDT insecticide, plastic, arsenic, lead, mercury, aluminum, chlorine, fluoride, antibiotic residues, and it just goes on. So when babies are already born with such a serious burden on their lymph system and on their kidneys and their liver and they're everywhere, what they didn't do in that study was to look for different infections. They weren't looking for mold or looking for viruses or looking for other things. And there are studies that I read where there was a Dr. Panjwani who did studies for about 5 years in Cambridge University with autoimmune diseases. And he found with genetic studies that 35% of our DNA are viral. Just like a breast cancer gene, viral genes, we're born with them. So with the understanding of epigenetics is it's not the gene that makes the disease, it's the environmental stresses that create the disease of the human cell. It's the environmental stresses that make the disease of the human cell. So environmental stresses, 1, we have 5G now. 2, we had 4G before 5G, not safe. People cook with microwave. We've got toxins that would irritate the cell, whether it's chlorine, it's fluoride, it's mercury, it's anesthesia, it's different things that get into the body. We've got pesticides, right? We've got weed killer spray. We've got a lot of things. We've got different meds that are used to cope with the symptoms instead of finding the cause and getting rid of it. So they don't need to be drugged, whether it's an emotional problem or it's a physical pain they're dealing with. The other environmental stress they found is negative emotions disease the cell. People have a negative self-talk that they do. The other is that there are different infections, and more now than ever. I mean, thinking of the past 3+ years with COVID and these COVID shots of more disease that happened, and it's going to happen for a long time to come, unfortunately, at the hands of some pretty, in my opinion, not some of the best people on this planet. But we've got to understand that there's more disease prevalence now because there's more toxins, there's more infections, there's more from an electronic standpoint, there's Wi-Fi modems, there is 5G tower, there's a lot that's going on. Okay, so And furthermore, when people get sick, let's say they had a sore throat and they're given an antibiotic and it doesn't really get rid of all the infection, for example, because there could be strep bacteria, but the urgent clinic who ran the culture of the person's throat didn't look to see whether a virus is. What if the throat's also swollen because of Epstein-Barr? That's there too, right? So they can give an antibiotic, and now we have antibiotic residues that are left in the body. Candida fungus can grow around the antibiotic residue, trying to clean it up. The candida can't eat it and spit it out, so the candida grows in the body, and now candida can attach to mercury. Candida will now carry the mercury to the brain or to another part of the body, making more disease occur, more symptoms occur. People go back to their MD, and it just keeps the loop. It just keeps going on and on and on. So unless people can start out in life by getting rid of these toxins and getting rid of the various infections that come their way in a safe and effective manner without drugs and without and by truly getting the job done, I think that we'd be healthier. It's unfortunate that people are sicker. There's a lot of sickness around. While people can live longer now, because medicines do keep people, can preserve life, or at least for some people, but there are many people who are just walking zombies. They're just, it's terrible. So I think part of your question before was about hormones. Did you ask me that?
Yeah.
Yeah. So hormones, you've got from the same idea that I just posed to you. When we've got people, let's say a woman has her ovaries are infected with candida and infected with, let's say, a staph infection, and their ovary also has mercury in it from something. Well, the ovary is not going to be able to help the body balance out the hormones or balance out her cycle. And let's also say that the liver, which is a filter in the body, what happens when the liver has some parasites and has some moles and has some fungus and has some other weed killer and has some antibiotic residues in there? What's going to happen with the liver's ability to help the person, the female, balance her hormones, or the man? It's not well. What happens if the anesthetic injected in the person's mouth to pull a tooth or fill a cavity went up to the pituitary gland and stayed there? How's the pituitary going to help regulate thyroid and regulate adrenal? You understand? So that's the point of view that I have. We've got to be able to start to cleanse these tissues, the sooner the better, so that we can help those glands normalize their function, and that can help the body truly, totally balance out the hormones.
So I have a theory that because people are a lot more promiscuous now than ever before, we're getting a lot more viruses and hidden stuff from that. And people are just looking at, the big ones and like, oh, I don't have the big ones. Meanwhile, they're carrying all these things to all their partners, with multiple partners now being so popular.
Sure. I'll agree. There's no doubt there. And you're right. It doesn't have to just be syphilis or HIV or chlamydia or gonorrhea. It could be that the male has influenza virus literally in his semen, and that's going across to the woman. And it could be that the male has, I'm not blaming men only, it can go both ways. It could be that the male has, let's say he had a parasite that he never knew because he has no inflammation or no itch or anything. And the parasite transfers through his semen to the female, to her cervix and to her uterus and so on. And yeah, 100% that it can cause the problems. It's also anything can pass, and literally through saliva. The one thing that we've got to understand is human saliva, and same as dogs, same as cats, but our saliva is carrying different germs and toxins. So whether or not it's just through, really, intimate relations, intercourse, there is saliva exchange in any way that's going to occur. Okay. So what I have found, because I test people's saliva, and I have found that the saliva, just like how we drink water to hydrate our brain and our body, the water goes to the skin, it goes to our bones, it goes to brain, it goes everywhere in the body to hydrate all tissues of the body. We need tissue hydrated. We're like 80% or whatever the true number is of water in the body. We're swallowing saliva when we swallow water. We're swallowing that saliva is going to go everywhere the water goes, into your heart, into your thyroid, into your brain, into your uterus, into your ovary. What happens when the saliva is made with, let's say that a person, man or woman, has herpes virus in the blood, okay? And the herpes virus goes to the glands that are in the mouth, in the cheek, and underneath the tongue to make the saliva. So the gland gets the blood with the herpes, and the gland is now going to make the saliva with the herpes. So now the saliva is carrying the herpes, and the person swallows that saliva, and the saliva with the herpes goes into the bloodstream because we digest it just like water. And the saliva can now be carried with the herpes to the brain, to the pituitary, to the ovary, to the liver, to the lymph, to the bone, to the anywhere. So now what happens when there's open mouth kissing? Even without, if somebody says, I'm going to remain celibate, I'm not going to have any kind of intimate relation beyond kissing, there could still be an exchange of organisms that way. And that's all it has to take in order to spread disease. These organisms are very smart, by the way. They've been around longer than humans existed on the planet. I mean, there's fossils of bacteria that are billions and billions of years old that have been discovered. So viruses too, they've been around here for a long time, and they know how to evade radar detection. You might have heard about Lyme disease.
Yes.
Where people get Lyme disease tests done. We're very successful with that, by the way, with this work. But Lyme disease tests are done, and there's a lot of false negatives. Supposedly 8 out of 10 times it could be negative, and when it's truly there in the human body. So if we think of from this perspective that people are probably a bit familiar with, let me use an analogy here, an airplane, right? What was it? Early 1900s, humans figured out how to fly an airplane for the first time ever in history. And within 100 years, we have an airplane that can fly the speed of sound, and we have an airplane that can evade radar detection. It can approach a country and they won't even know the plane is coming. So if we can do that as humans, create an airplane that can fly the speed of sound, as well as evade radar detection in 100 years of figuring out how to fly an airplane, do you think that a Lyme disease bug, as it's called, like a Borrelia bug, which has been around here for billions of years, and they can morph themselves into different shapes, and they can become antibiotic resistant organisms, are they able to avoid radar detection in a blood test or a stool test? The answer is yes. So we've got to use finer methods. That's why I do what I do. We've got to use different methods that can actually work to find these different disease-causing infections and chemicals in parts of the brain and the body and help the person safely and effectively rid it, so we can really see the end to those terrible diseases that people suffer from. So
I've heard that in some scans of, let's say, breast tumors or whatever, they found worms. Is that something that happens?
I believe so. So I'll tell you, I don't see pictures of that, but the worms can happen anywhere in the body because people can consume some food or consume, just like a dog. A dog might pick up some food on the floor. I have 3 beautiful puppies who I love. So I've got to be very cautious because they don't pick up they don't have hands, right? They just pick up with their mouth and they'll play and throw something up, but they'll pick up things and just eat. And I've got to be very cautious with them because a dog can get a tapeworm. A dog can get different kinds of parasites that they've actually done surgeries on dogs and found worms literally in the body. Same for humans. In different parts of the world, they have done procedure where they see literally worms in people. So yes, it could be in the breast. It could be anywhere in the human body. We actually, without worms, I'll say, though, since you asked that question about breast tissue, we have one of several patients, one woman who had multiple cysts in her right breast and multiple in the left breast. Not only to her palpation of her feeling, her self-inspection of her breast tissue of right and left breast, not only was she able to tell that they were there, but she also had mammogram and ultrasound studies that proved that there were multiple cysts in the right breast and multiple in the left breast. And she did not want to get a biopsy. When I met her, she already had the scans done. It was way before I met her that she knew. It was, I don't know, way before. It was like 6 months, if I remember correctly, before I ever met her. She had the scans that showed it was there. She was afraid of a biopsy. Because they said they don't think it was cancerous, but she should get a biopsy anyway to make sure. She didn't want the biopsy. So she finds out about my work. She comes here. We do, after 3 treatments, by removing what I found was candida, I found mold, I found bacteria that I believe were the causes of these cystic growths in her breast. And so during the protocols that we customized for her that she did at home, very easy to follow, she was doing follow-up every 3 months with a mammogram. Not that I didn't recommend it, but she wanted to do it. That was her decision, and her medical doctor ordered the mammogram. I don't like too much x-ray. It's not good for the body. So, but she had mammogram and she had ultrasound every 3 months. And what we saw was the cysts were shrinking and disappearing. So by the 4th follow-up mammogram and ultrasound, 0 cysts in the right breast, 0 in the left breast. I have a video that we produced that we put up on my YouTube channel, 0 cysts. And the patient is on camera with me saying, yes, Dr. Herman. Basically, I did a very quick one with her. She was shy of the camera. She was afraid to just be in front of the camera, but yes, Dr. Herman, it was only you. There was no medical treatment. There was no surgery, nothing else. That she did nothing else but this work. So we saw those cysts disappear. I didn't see them as worms, back to what you asked me, before, but anything can happen. Any infection can grow in any part of the body.
Mm. So, you said that they do it at home too.
Yes.
So you sell them like a device and you teach them how to use it type of thing?
No device. So back to that idea, like the Rife machine, that's what I was doing before. That's probably like 10, 11 years ago. And when I didn't see people with lupus or people with a thyroid disease or heart disease or nerve pain, like neuropathy, numb, painful feet, when I didn't see those symptoms going away, chronic fatigue wasn't going away, endometriosis wasn't going away, then I said, I've got to do something different, because setting up different programs, thinking it's Lyme disease or thinking it's parasites or thinking whatever, and somebody has to sit with a machine for hours or days, day and night. I mean, 10 hours a day, 3 hours a day, 2 hours a day, whatever it was. It was a hassle for the person because they had to stay locked in a room with the machine. And B, I wasn't seeing the positive outcome. So I'm not doubting that a machine like that could do some benefit for a person. That's not my point. I have to, for my work, I've got to deliver results for people in the shortest period of time possible. And I've got to be able to, the results being reduction in symptoms, in improvement in laboratory findings, laboratory analysis. But I've also got to make it easier for them to do than having to stay strapped to a machine in their home for days or weeks at a time. So what we discovered is, and this is actually, it's in my ebook that's free to download on my website. There's research, and you could also look this up later. There's a video on YouTube called Water's Memory. And I'll mention a couple of different scientists here, or their studies. Is number one, there's a doctor who passed away recently, Dr. Emoto, a Japanese physician. And if you know about this, where he talked emotions, he was able to see that the water held love, or held evil, or held hate, or held tranquility, or angel, or peace. So he was able to see the emotion spoken or thought to the water can program that water to carry a certain appearance, whether it's angel looked like a halo, literally in the water when he froze it. Every single time it was identical, to where if he took the same water and said, I hate you, the water looked different than what it did before when he said angel to the water, or I love you to the water, or so on. So water can be programmed. Water's Memory video, it's not about Dr. Emoto, it's about these two scientists in Europe, one who was a Nobel Prize winner for discovering with HIV, Dr. Montagnier, and there's a Dr. Benaviste. What they discovered, and they did starting in the 90s, they were able to program water to be acting like a medicine. Okay, not produced by a drug company. So we can program water, let's say, with the frequency of, for example, the influenza virus that's in the person's stomach, that's causing their stomach pain. So now they take one liquid drop of the frequency that we program the water with the influenza virus for the stomach. When the person takes that remedy, it goes right to the stomach, and the body will get rid of the influenza virus from the stomach and settle down the symptoms. So it's like in a way, it's similar to a homeopathic remedy, which I thought years ago. I'll tell you, when I got into functional medicine, and I was in functional neurology, I was so into the scientific labs have to be it. And a patient said, you should learn this kind of different way of like a muscle testing. And I was like, come on. Until I went to an alternative cancer class, because I was so into the science and all the genetic testing. And until a friend of mine, her mother had ovarian cancer, and I was clueless. What do I do? There's no lab I'm going to run. What the hell? What am I thinking? I'm going to advise her to do anything. And she died very quickly, though, with the cancer doctor surgery and so on. It just didn't chemo. It didn't work for her, unfortunately. She was a beautiful woman. Too bad, too soon that she was gone from the planet. But it was something that I realized quickly that I just lost track. I'm sorry, thinking about her just now. Sorry for that. But it was, remind me of where we were. Excuse me.
Homeopathy.
Homeopathy. Thank you. So homeopathy, what I learned about it is that there's a Like cures like is the principle there. And when I looked at the history of homeopathy, that the Dr. Hahnemann, who discovered or coined the phrase homeopathy, people with malaria symptoms in Europe where he lived, people were using a substance from a bark of a tree, and this one particular tree, not any tree, this one that would cure the malaria symptoms. He didn't have malaria, but when he consumed the substance, he had no symptoms. When he consumed the substance, he developed symptoms like he had malaria, but he didn't have it. When he stopped consuming it, his symptoms disappeared. He consumed it again, symptoms came back. Stopped consuming it, symptoms disappeared. But all the people who had malaria for years, when they consumed the substance, one substance, not any, one, they cured themselves. So he tried the experiment with family and friends. They had no malaria, they had no symptoms. They consumed the same substance that cured the people of malaria, that made him feel like he had malaria when he took it, that cured them. They all developed the same pattern of symptoms like he did, like they had it. When they stopped consuming it, their symptoms went away. So he came up with this idea that the like energy, it was a similar energy to the malaria parasite that was in the substance in the bark of the tree. So when they consumed it, it would knock out the malaria from the body. That was his idea. And he went on, he became very popular. There's a statue of him in France. He's very well known in certain circles. This work with these biophysicists and these brilliant doctors discovered is that we can take water, like Dr. Emoto proved that we can program it within motion. We can program it with the frequency of the bug that's infecting the organ. So now, like yours, like we're carrying the exact energy. I'll give you an example in a moment. The exact energy of that infection when the person takes the liquid remedy, one drop of it, one drop, carrying that frequency of that infection, it goes right to the organ. The body helps itself get rid of it, like cures like. So if we could use one example, let's say somebody had a strep throat. They have a sore throat, the throat hurts, it's hard to swallow, hard to speak, it's hard to drink, hard to eat, hard to sleep. And the person goes to like a urgent care clinic and they take a cotton swab, take some of the saliva, put it on a culture dish. They come back in a few minutes. Yep, you got strep throat. What these scientists were able to do is measure the frequency of that strep bacteria, that specific strep that was in the person's throat. Besides the culture that showed that it was strep, they put it into this device that measured its energy level. So like an FM radio dial, I don't know, some people don't listen to FM anymore. It's all Pandora and iTunes now, but on an FM radio dial, you could get in a car and turn the radio on and turn the dial that changes the frequency of the radio wave. So let's say it's 103.5 or 100.7 or 93.1, right? Those frequencies to hear the music and the DJ on those different radio stations or radio waves. What these doctors figured out is to measure the frequency of, let's say, the strep infection. So they found the strep, I'll make up a number, it's not that important, but just let's hypothetically, it's 103.5 for strep, okay? They made a machine like a jumper cable, good battery to bad battery, it travels through the wire to start up the car. They made a machine that had a wire like that of a jumper cable, so to speak, where they put the strep 103.5 frequency, strep itself in the vial with a cap on it, sealed, put it on one side of the machine with a wire connecting the strep infection to another side of the machine where they took water and they measured the water at first. It was zero frequency. They put that in a sealed vial onto the other side of the machine. They turned the machine on, they turned the machine off, and then they took out both samples. They measured that strep that they put in first. It was still 103.5. Nothing changed. They took out the water. They measured it. Now, it was zero when they put it in. When they took it out, it was also 103.5 frequency, identical to the strep infection. They measured one drop of that liquid. It was also 103.5. They measured the whole bottle. It was 103. It was identical. It didn't matter how much was used. It was the same energy. You understand?
Mm-hmm.
Does that make sense? So they gave that one drop of that strep frequencied water, like cures like principle. They gave one drop of that and the person's strep throat within a day was gone without any other assistance.
I worked for a vet for a few years that did only homeopathy on animals. And because everybody says, oh, it's placebo, it doesn't really work. And animals can't have placebo effects.
No, absolutely not. You're right. They don't know. And you can't ask a dog or cat. And I have three beautiful, I've got little Frenchie bulldogs. I love them. They're my favorite. But I can't ask them, like, how's your stomach today? How are you feeling? You know, they're either going to be scratching because they have a rash or they're not, or they're going to have diarrhea or not. There's no placebo that when we apply something, because I test and treat them all the time, they're not going to, they can't lie to me. They can't make up, there's no story they can tell me. You're 100% right. So what you saw there, things did work for these animals where you worked in the vet.
I saw dogs not being able to walk, walking out after a couple of treatments.
Yeah.
Insane.
Yeah. So those are classical homeopathic remedies, possibly what you're describing, and it
Hmm.
did make that happen. So those
Yes.
are impressive. So you saw it, you lived it. I'll tell you with this, it's even that's wonderful. So first, I'm not taking anything away from that vet. That's awesome. I love it. I love to hear it. And congratulations to him,
Him.
that doctor, him, and also the families with the pets who were lucky enough to have him as their vet. That's wonderful. With this work, it even gets more precise because we're able to detect exactly what's in that person's body part that made the disease and make an exact identical energy replica of it, so to speak. So uh, um, it's but that work is wonderful. What you just mentioned. It's just that we can find what we're able to do with this. I could find if it's a vaccine that's hurting the person and get that out of them because we can make an energy duplicate of it. We're not giving them an injection. We're giving them one water drop to take of the frequency of the tetanus shot that caused them back pain that I find. To take a remedy of that tetanus shot, it neutralizes that and helps the body evacuate the tetanus from, let's say, the kidney, and the back pain disappears, for example. Or let's say there's an MMR vaccine that got into a child's brain, and all of a sudden later that day after the MMR shot or the second or third MMR shot, and all of a sudden they're acting autistic. We can get the MMR out of the brain. If it's, I can go on a long list, but it's anything. Anesthesia chemicals, antibiotics that have caused people problems, we can get those out of people with this work, and the list goes on.
Knowing everything that you know, how do you take care of your teeth? What kind of, do you take any supplements? What does your health hygiene look like?
First is this is number one to me now. This is number one. I'm able to find anything in my body that's causing me a symptom. If it's a back pain, if it's neck pain, if it's a stiffness like my shoulder felt like it was not feeling too good because I thought I was training too hard in the gym. If it's I got a sore throat, it's whatever it is. We can I apply this to me, my exam step that I do, and I find the different things and I follow with my protocols, the remedies that we make to help my body get rid of it. Me personally, I don't use fluoride toothpaste. I uh, I I clean. I get a usually it's a new toothbrush every 2 to 4 weeks because who knows what could be living on it. I'll tell you, it's not just rinsing it under cold water or hot water in the sink or putting it into hydrogen peroxide. Maybe that's going to cleanse it. I don't know. Um, I don't like to wear, and I wish I did like years ago, but I don't like to wear colognes or anything like that because different fragrances. I haven't even talked about that in this discussion with you yet, but different fragrances I find stressing people. It's not just smelling bleach that's poisonous. It could be anything. Even smelling cinnamon can trigger a reaction in a person's body. Even smelling vinegar, apple cider vinegar is supposed to be the great, candida cleanser. I'll tell you what, just smelling it, I'm finding it hurting people because of different infections and chemicals that are in their central nervous system or in their organs that make them stressed by the vinegar. So fragrances hurt. So I don't like colognes. We don't like to use chemical different cleaners in the house. That's a tough call because when it comes to cleaning, we got to have a clean house. It's just like like what do you do? So if we're going to have somebody over to clean our house, then and they're going to use chemicals, open up the windows, open up the doors. I don't want it. I want to be, when I come home, I want all that odor of chemicals gone. But sometimes those are necessary because even what I just said before, like a vinegar can hurt someone just by smelling it or tasting it. I didn't talk about the tasting strategy, but some of these countertop cleaners that are not chemicals like a bleach or like a whatever else out there, they have vinegars in them and that can actually hurt a person from smelling it. So that's a very tough call. Cleaning, I use a water pick twice a day, once or twice a day. I have a floss and a special gum cleaning tool that I get from the store. I brush 2, 3, 4 times a day. Dentist cleaning every probably 6 months. If there's an infection in the mouth, it's got to be dealt with immediately because the infection from the mouth can be traveling anywhere, any time of the day and night to any part of the brain and the body and making disease occur immediately or down the road. All organic food in our house. All organic food in the house, but that doesn't mean that I don't sometimes go out to a restaurant and check my brain at the door and eat the food that's there. That's I know is not organic. Water. I most of what I drink, the most of my consumption of fluid is water, and the water I don't. Sometimes we have like a bottled water which I love. A couple of different brands out there. I don't have to promote them right now here in this call with you, but I have a water distiller that's an automatic water distiller. I like distilled better than other filter devices because the filters don't get everything out. Maybe it gets out lead and it gets out fluoride or chlorine, but what if it's not able to get out mold toxins? What if there's molds that are in some of the water, the pipes that bring water to the building or the house that you live in, and those molds are releasing mold toxins, which I do find in people's water. People bring the water to my clinic and I test their water. And even with some top filter devices that they have that they thought was cleaning their water of anything that could hurt them, I found mold toxins in these waters. So mycotoxins hurt people. So I use a water distiller, and we just put minerals because it takes out minerals also, but we put the minerals back into the water to drink it. And that's pretty much what we do. Healthy food, good exercise, and clean mouth, and clean food, and clean water, and pray for the best that there's no horrible, some other unfortunate incident in life.
And what about EMFs? Are you concerned about
Yes,
those? Okay.
highly. So on my computer, glad you brought that up. I left that out before. But my computer, my cell phone, my automobile, my SUV, my televisions at home, the subwoofer, the Wi-Fi modem, the walls. We have devices that we get from a company in Germany that and even on the computers here in my clinic, and even in my clinic where I see people, we have to neutralize all the EMFs, completely neutralize them. So these devices do the job. There are many companies that say they can get the job done with neutralizing the EMF in the environment. I spent a lot of money over the years on different devices from different companies that just didn't work. Once I realized how to test for it, I realized it wasn't working. And that doesn't mean testing with a frequency reading device that you could point at like a Wi-Fi modem and see the scanning, screaming device. We've got to be able to find the human body is stressed or not by the EMF. So that's a unique way to look at it. It's not, Ken, that is the Wi-Fi modem still putting out a signal? Of course it is. It's just, will the body be hurt by that signal? And that's where the key comes in of these devices, because they can imagine that the EMF is spiraling at the body in a clockwise manner. This reverses it, so it's going counterclockwise, so it doesn't hurt the body. And we also have these remedies, or these quantum energized formulas. When we test people, we've got to remove the EMF from their body first. So that's the other thing about using some computer device. No, because what happens when the x-ray, if somebody just went in for a CT scan before they come to me, I've got to get that CT scan x-ray energy out of them, because I don't want to get a false reading and think that the stomach is infected when it's not. Usually stomachs are infected, but stomach's infected when it's not the reason for their headache. I'm reading the x-ray by accident. I'm thinking it's a stomach infection, because the body will produce a false reading. So we've got to be able to neutralize these EMFs in the environment where my work is done, or where I do my work, as well as in my home. So that I do to protect anybody who's in here, as well as being able to get the right answer with a person. So EMFs are a big deal. And to what degree is 5G? It's not healthy for us. There's no way that these different frequencies around us are healthy. Cell phone energies are not healthy. We found there's information that scientists did studies where EMF was actually promoting the growth of organisms in the human body. EMF within 15 minutes before and after somebody was on an unprotected cell phone, they took blood from the person. The person's blood looked healthy. 15 minutes after an unprotected cell phone. That doesn't mean a case like a rubber thing, so if you drop it, it doesn't break the cell phone. I'm talking protection from the EMF of the cell phone. So before and after cell phone use, before the blood looked healthy, 15 minutes of cell phone use, the blood looked like it had cancer in it. Just from that alone. It's terrible. So it is really important that people would invest in devices that can truly neutralize the EMF that's released from these different devices and their home and their smart meter and their circuit breaker and all these things, in order to have a better chance at not letting disease happen in the body.
Mm-hmm. And what do you think about red light therapy?
I had tried in the past that, but I don't really know. Let me say this. I tried a lot of different things. That was one of them. I didn't see the results for people. Some people can claim. There are companies that claim. There are different physicians who can claim, and maybe you can go to their clinic and try or spend a little money and give it a couple of tries. I just wasn't seeing it happen. I wasn't seeing it deliver the goods for people. So I just don't use it. So that's all.
Mm.
I have nothing bad to say about it. I just will say that I don't use it because I couldn't, and patients were not seeing the results. So I left it aside. Maybe somebody else is better at applying red light. I just red light. So again, what if somebody has an anesthetic that's in their kidney? What if a woman has fibromyalgia and she has terrible back pain where it's just like agony for her? No exaggeration. There are people you could have a woman who's 30 years old who just gave birth to a baby. She had a C-section and they gave her that epidural. The epidural goes to the kidney. The body's not strong enough. Remember, I talked about the body burden study earlier. And what if that woman's not strong enough to release the toxins because the kidneys are already burdened by other toxins that are in there? So now they inject her in the back. The epidural ends up in her kidneys. And now she's got undeniable nonstop lower back pain. So you can do red light therapy, but it's not going to get the kidney to release that epidural that's become deeply embedded, saturated in the kidney. With me, with one remedy, they can take the specific remedy of the kidney and the epidural. I'm not giving them the epidural, but they can take the frequencies of those. And once it goes right to the kidney, the body's going to just squeeze out that epidural and then it's gone, back pain gone. We have a testimonial from a woman. Her daughter, she brought her daughter here, was like 11 at the time. Daughter had brain fog, a number of things, chronic fatigue, terrible bloating, and a number of symptoms. A little girl who's better now, 100% better now. And then they brought the husband in, the father of the husband in. And then the mother, who I met first day when she brought her daughter here, after she saw the daughter get better, and then she sees the husband get better, she's a patient. And she had fibromyalgia for 15 years. She thought she was dying. And back pain was, for her, she told me it was agony. And then it was the third or fourth day in her first protocol that I did for her. Her first remedy was to get the epidural out of the kidneys. It's about the fourth or so day of her first protocol. She was in shock. She bent over to take dishes out of the dishwasher. There was no restriction. There was no pain. All the back pain of 15 years that was nonstop after she gave childbirth, the back pain disappeared. It hasn't come back. It was the epidural, excuse me for that. The epidural was in the kidneys. We got it out of there. The back pain disappeared. Nobody knew why she had back pain. She doesn't have any fibromyalgia pain now either. It's all gone. Not just from that one part of the treatment. There were other things, getting rid of other infections and chemicals, but she's normal. She's happy.
Mm.
So I don't see how red light therapy is going to get rid of the epidural from somebody's kidney or get rid of mercury from the brain or something that's causing the problem.
So it's more like a Band-Aid on a bullet.
If it's even a Band-Aid, what if it doesn't Band-Aid? What if you put a Band-Aid on an open sore, an open cut, and the cut is so deep that the Band-Aid doesn't stop the bleeding because you need stitches and you need to wrap it and you need to do other things. So I understand the word that you use there, but what if it doesn't even Band-Aid the situation? What if it's just a treatment that somebody could use, but it doesn't at all rid the nerve pain that somebody has in their feet or their hands or their body? What if that's the case? There was a patient who came, I'll bring up another example. I think it was, if I remember correctly, it was a few years ago. He was probably like 30, maybe he was mid 30s. I don't remember the exact age. Anyway, he came to my clinic in South Florida from Virginia. Never left Virginia in his life, he told me. Never left home. For 8 months, he felt like he was dying. His mother, his aunt told me he feels like he's dying. He's dying. He's dying. That's all he said. He had a burning pain from head to toe, whole body. Young guy, burning pain head to toe. And when he'd walk, he felt like he was walking on broken glass. He was walking on the edges of his feet like this on the pinky toe side of the foot. It was so hard for him to walk with shoe, without shoe. It was extreme difficulty. 8 months. He was type 1 diabetic. The doctors in the hospital's ER visits, they said it's caused your diabetes, causing you this nerve pain. He didn't buy it. At least his family tried to help him outside because he was suffering terribly for 8 months of no sleep and just crying and just thinking he's dying. And so in the first visit with me, I found malaria was one of the reasons. He never left Virginia. Where'd he get malaria? It's not like it happened in, the Amazon jungle. It happened in Virginia. Mosquitoes carry around disease and we can get infected. Just like a tick bite with Lyme disease, mosquitoes transfer things to humans too. So when we treated that, one of the main things that we treated in the first round, he came back to me, second visit, aunt, mother with him. Aunt gets up, hugs me. You saved his life. You saved his life. And he's like, my pain is gone. My pain is gone. He was able to walk without feeling broken glass. All the burning disappeared.
Mm.
So there's a lot of possibility. So I don't see how red light therapy or others are going to get rid of what I just said. It's got to be specific. So I don't think band-aiding, I know what you mean. I just don't, because for me, band-aid is going to stop the bleeding. It might not get rid of something else, but it's going to stop the bleeding. But when the symptom doesn't reduce because they're not getting to the root cause. Now, can some people be lucky with a treatment like that? Maybe they're lucky with it. And that's great for them. But I think that it's not really going to help get rid of the root cause. That's my opinion.
Mm. Okay. So do you find, because I can't think of one person that I know that doesn't have 500 different
You're right.
possible causes. So how do you even begin with that?
Good question. So people are loaded, right? Even people who don't have symptoms at 30 years old, don't have symptoms at 40, they did great in school, they do good in business, they're good parents, they have no pain. Maybe once in a while there's a pain, they're not asthmatic, they don't have any stomach problems, they don't have any ulcers, they're just fine. If they had diarrhea one time, they caught a food poisoning, it's called. But then all of a sudden they have heart disease that happens at 55. Or all of a sudden they're getting like dementia at like 60 something years old, or sooner or later. So how do I start? I'll just say that people can be symptom free for many years, and then all of a sudden they just get hit hard with a terrible symptom that can be so life alter their function and their course in life. It's terrible what these different toxins and infections can do to people. So with that said, I developed a system where I'm able to, and it took a lot of time, a lot of work, a lot of effort, a lot of focus for years, to be able to use different strategies in my exam process that will help me. Is it a respiratory problem? I have certain respiratory strategies. Is it a skin rash? I have certain skin rash strategies. Is it a brain fog, or they're getting dementia? I have certain strategies for that. I do have to assess different things in the environment of the individual. First, is are the teeth loaded with toxins? Are there infections? Are there abscesses? Or is there root canals in the mouth that are part of the problem? I've got to understand what toxins. Maybe they've had surgeries in the past, maybe not. I'm just saying maybe they had certain injections, maybe not. Maybe they've been on drugs, maybe not. I'm talking street drugs, not just medication drugs. So I've got to be able to really do a thorough discussion with them, a pre-examination type of consultation discussion. I've got to look over their records that pertain to any kind of hospital or medical, treatment or doctor's visits, connect that to what their symptoms are. And I've got to also, and see what doctors might have missed doing for them. But I've also got to ask them from the standpoint of what other infections or toxins they may have been around, possibly, but some people just have no idea what it is. But I've developed certain strategies, whether it's POTS, whether it's endometriosis, whether it's a breast problem, whether it's a thyroid problem, whether it's a skin rash, whether it's some type of brain disorder of some kind, whether it's just a back pain, it's a nerve pain. I have certain strategies, and it's so many to list here. I have certain strategies that I've realized that will help me get from point A to B, means going from pain to no pain faster for the person, a disease to no disease, or cyst to no cyst faster for the person. So it would take me a long time to describe all those to you, but I do, it's like most women, I don't know you well enough, but most women have a great intuition. There's like a sixth sense. And women, probably more than some men, are more tied into that kind of energy around them. You can pick up, I think you're a mother, you told me?
Yes.
So you would know if there's something wrong with your child.
Mm-hmm.
You can just pick it up even if the child's not telling you. You're like, something's wrong. What's going on, right? And so we do have sort of a sixth sense. We have an intuition. And if we don't have it developed, when we spend enough time with looking to develop that intuition or that reading the energy of the person, it makes it a little easier. So I've been at this for years to be able to. I remember in the beginning, I was like, how am I ever going to do that? I have no idea, because I never tried to tap into that part of me. But now, and it sounds to some people that's woo, that's kind of voodoo. I'll tell you something. When you can see the before and after of people with Parkinson's, where we see the tremors stop, when we can see, and some it takes longer than others, when we hear women with endometriosis symptoms, no more. When we see asthma, gone. Rashes on the skin that they had for a lifetime, gone. Migraines for decades, gone. Congestive heart failure, no longer. back pain, fibromyalgia, thyroid, Hashimoto's, where I see the before and after scans where they can't find an active Hashimoto's anymore. I have proof of that. It's out of the box thinking. It's out of the box type of, if we can say, therapy for the person or treatment for the person. The thing is that for people who, like you, could be more into this because you saw it at the veterinarian, you got an idea of true, real, rapid healing, where other people would say that's impossible. That's all voodoo stuff. With this, I'll tell you, the people who I meet, number one, who come to me for care, number one, they've already tried many other systems, or one or many other systems that have failed them. Medicine, conventional medicine, as well as many alternative types of treatments or therapies that failed them. I've even had medical doctors come in here who are suffering with symptoms, where they've come to me and just like, you're the only one who makes sense. I have to try this. And then they see results, and then they get it. Or for their family member, they start to see results with the family member, and they were so ingrained in the conventional medicine way of thinking. And then they start to get it, of understanding, because people come to me, they're sort of at their wit's end. I'm the one who, I like to save somebody who's just like they've already gone through it all. I'm not the first one on the totem pole for them. I'm usually the last one. With these patients, though, it's such a revelation for them when they start to see their symptoms go away. Hopefully it takes one treatment. I'd rather that be than take 2 or 3 or 4. But I don't know how many different, if we can say, holes are in the bottom of the rowboat making the boat sink. I don't know how many different infections and chemicals brought it on. Like you just said, 500 different ones. So again, back to your question, there's different strategies I developed. And when we can see people coming out of the disease, there's no greater reward. There's no greater pleasure that we have than just knowing it was the answer for the person. It is the answer for the person who suffered for at sometimes decades. So it's pretty remarkable.
Well, I want to be mindful of your time. Is there anything you would like to leave us with before we go? And can you tell everyone how to work with you? Do you work with people out of state? How does that work?
Sure. Thank you for that offer. I'll just say that for the person with the open mind, then it may be easier to grasp. For the person with a closed mind, maybe they have to listen to this again and start to say, well, that's kind of making sense to me. Let me look up at his website. Let me look at some of those testimonials. Let me hear his discussions. So on my videos that I put onto my YouTube channel that are also connected to my website, I do get into deeper discussion when I show the before and after. When you hear people actually describing, this is what did it for me, basically. And they tell you how bad their life was and how good it is now, or we see the rashes go away, or we see the function. They couldn't stand up from a chair. Now they could. When I make my videos, I'm describing the kind of exam findings. I found mercury in the brain. I found the epidural in the kidney. I found there was anesthetic from the dentist on the thyroid. I found there was mold in the lungs, whatever it is. Not minimizing their findings, but just to give you an idea, I describe in great detail how I pinpointed these specific disease-causing infections and toxins, and how we provided the treatment to help cleanse the cells of these different disease-causing agents. So that's one thing, that they can watch those videos and get more detail from me. The other is, I might have mentioned earlier, where on my website, drlonnieherman.com. Maybe we'll be able to put that somewhere in this description so they can see that and click on it. I've got a free copy of my ebook that they can download for free, and they can read more about this. And there's links inside my ebook. That's only 40 pages. There's a lot of big pictures and big font. It's maybe 30 minutes, maybe longer, maybe easy to read in layman's terms, very easy to read. So there's links that take people to the food analysis page that's on my website about my food testing, the dental page, and also a video right at the end on the last page where I go into my method and my journey as a physician and helping them realize all the school and all the different labs I used to run. But the point is about getting the person better. So there's a lot of information in that video, a lot in that book, on my website and my YouTube channel.
Okay, awesome. All of that will be in the show notes. Thank you so much for your time.
Thank you for having me. I really appreciate it. And we've just got to get to people well. That's what matters.
Thank you.